1 in 3 people in Bartow County, 1 in 3 is uninsured or underinsured. Among the folks in Bartow County who work, 1/4 or 1 in 4 are uninsured.
Maybe they're working multiple jobs, maybe 2 part-time jobs, if you will, trying to make ends meet.
These are people who are working families, who are working jobs, but they're not able to afford their health insurance.
So they go to work every day, but they don't have health insurance either through their employer or it's not affordable for them to purchase.
I believe it creates an enormous amount of stress for those families who are trying to work, who are trying to make a mortgage payment, a rent payment.
We see a lot of people that are working that come here that have a full-time job, they're taking care of their family, they're raising their kids, they got a house and all to pay, but they just don't have insurance.
They're going to soccer games, they're paying their bills, they're trying to find ways to keep food on the table and meet all of their obligations. Right now we've seen about a 24% increase in insurance premiums just since the implementation of the Affordable Care Act.
You end up in the emergency room. That is not effective for you. You don't get preventative measures. You also don't get good follow-up care, and it's incredibly expensive for the community.
People use the ER as their doctor because they wait so long until they get very sick and it becomes an emergency. And so they use the emergency room as a place to receive primary care.
The ER is the most expensive place in the hospital to be treated.
It's great to have a good emergency room available to people because there are times when they need it. But that's not the place to get your primary care, your frontline care. You know, the place you need to do that is in the office that serves as an appropriate medical home.
Everybody needs a health home.
We want to be your partner in your health care. At Bartow Health Access, patients participate in their health care and pay based on their ability to pay. So they pay on a sliding fee scale, and the sliding fee scale is determined based on their household income and their family size. Nobody's denied services based on their ability to pay.
And knowing that these individuals work hard, but the only reason they're not getting health care is that they feel they can't afford it. We deal with the whole person. We don't just take care of the physical part, but we also deal with the mental part. So we address the mental health issues and dental health. There's a clear link between the oral health care and health care of the individual in general.
Bartow Health Access has a whole network of specialists that they can refer to. This is the one place that people can go for their physical health, their mental health, and their dental health.
It's important for patients or for people to have the opportunity to establish a relationship with a physician.
We can provide complete health care for everyone in the family, from the infant all the way to the grandparents. Our patients are involved in their health care.
The value of a health home is that you have a doctor who knows you, they know your situation, they know your past history.
This development of acquiring a family physician, a nurse practitioner, a team that can gather around those patients.
The doctors on staff, the nurses on staff will become that connection with that individual and their health care.
That's going to be the difference that will make a difference in the community. It is a big deal.
Our community is in great need of a place like Bartow Health Access. We don't have a clinic here in town, and many of our other hospitals that we're affiliated across the United States, they have clinics in their community, and so they're not inundated with patients coming to the ER who can't afford it, who don't have insurance or who are uninsured, and they can go to the clinic and get that care they need.
About 25% of our budget is made up from patient revenue, and the other 75% is made up through the generosity of donors. We want to be your home for health care.
Everybody needs a health home.
We want to be your new home for health care.
we're doing the kind of job that communities need us to be doing to improve the general health of the community. So everybody wins.
Be a part of our community. Be a part of Bartow Health Access.